Hello, I'm Dr. Leibovitz, your Central Indiana go-to foot doc. Today's feature is something I like to call foot and ankle questions, my version of FAQs. We've had a lot of questions about bunion deformities. So our first question, what is a bunion? Well, that's a specific deformity about the great toe joint. I have a lot of patients come in that claim they have bunions and they're describing every lump and bump that occurs in the foot, and that's not the case. This is specifically for the great toe joint. Now there's two different types of bunions. All these questions are going to be related to the most common bunion. It's called the hallux adductor valgus. And what we're going to see is the big toe begins to slant towards the second toe, and we start to see a lump occurring over the first metatarsal head. That's a foot that gets to be more difficult to fit into a shoe. Okay, second question. What causes a bunion and how do you get bunions? We'll address both of those at the same time. Well, they're not contagious. Maintaining social distancing and using a mask is not going to help you prevent bunions. What will help you though is choosing your parents and grandparents properly. There's a very strong factor of hereditary that gives you the mechanics. They don't give you the deformity, but they give you the mechanics that will create the deformity later on in life. There are juvenile bunions, and that's kind of a combination of both the mechanics and uterine position. Trauma can cause bunions, but usually it's on one side, and that deals with limited motion. Bunions are very slow in progression. We usually don't even see symptoms till 30 or 40 years of age. They usually occur on both sides, but one side's more aggressive. What does not cause bunions is shoes. Dress shoes, heels get blamed for bunions. They don't cause them, but they can accelerate the process. One of my favorite stories is I have 60, 70, 80-year-old people come in and they have bunion deformities and symptoms for 20 plus years. But they can remember when they're 4 years old, they got a hand-me-down pair of shoes from their siblings, and that specifically would cause their problems that developed 50, 60 years later. Not so much really the case. Third question, what does a bunion look like? Well, they say that x-ray is worth 1,000 words. And what we're looking at here is the foot is basically a five-legged table. We're looking at the largest table leg, the first metatarsal. So if we look at the joints, the one that's labeled number 1, it actually occurs in the middle of the foot, and when the foot pronates, that slowly becomes unstable, and we start to see that slant like a gate hinge opening up, and it tilts away from the second metatarsal. Now if we focus in on the second joint, as that first metatarsal separates, we see the big toe drift closer to the second toe. Now looking at that big bump that occurs on the inside of the foot at the first metatarsal, that's not really a large bone, but it's a bone that's been displaced. So if I had a jawbreaker and I put that in my mouth and I pushed it to the side, we'll see a lump. And if I push it out further, it looks larger. Although the jawbreaker hasn't grown in size, it definitely has been displaced. That's exactly like a bunion deformity. The more that bone tilts out, the larger that bone looks, the lump looks. So bunions can create secondary problems too. Contracted toes or hammer toes, a capsulitis, which is a pain underneath the foot, usually the second metatarsal, callus formation, as well as pressure points between all the toes. So our long distance question comes from Tanzania. I have a bunion deformity and now my second and third toes are floating off the ground. Well, this is a perfect example of those secondary type of problems that can be created. As that first toe drifts over, it's starting to take the parking spot of the second toe, and the big guy always wins. The second toe eventually drifts over, and then it eventually drifts up, and slowly it becomes dislocated and will just hover over the ground. This is more of a personal question for me, is do I have bunion deformities? No, I don't, but I am a recovering plantar fascia patient. So those were a lot of short questions with a lot of short answers. If you want a lot more details, we have extended videos that talk about the two types of bunions, as well as hallux limitus, the mogul killer for skiers, and also kids can get bunions. So we also have in-depth articles and blogs on our webpage. Feel free to go there. If you have any questions, let me know. Send them to my webpage through the contact form, Facebook, I'll get those. Our next video, we're going to be talking about the what's and how's of treating bunions. A little tip of the day, if you're not a big fan of Mike Rowe or you don't know about him, he has a project on Facebook called Returning the Favor, very uplifting. It will be some of the best 20 minutes you'll spend of your day. Another project that he has is you can find it on YouTube. It's called That's the Way I Heard It. It's kind of a continuation of Paul Harvey, if you're old enough to remember him. I hope you enjoyed and learned a little bit about bunions. I'm Dr. Leibovitz, your Central Indiana go-to foot doc.